A single act of generosity can become the beginning of something much greater. In the Diocese of Buea, Cameroon, what began thousands of kilometers away has grown into a partnership transforming lives through education, pastoral care, and health care. The story began when Dr. Apollinaris Mba, a Cameroonian-born physician practicing in the United States and founder of Impact Changing Outcomes, successfully treated a patient who, in gratitude, wished to make a charitable contribution. Through Dr. Mba, that generosity was connected to the Diocese of Buea, where one pressing need was St. Augustine Nursery Primary School, Tiko.
I want to use this opportunity to thank the husband of Sandy, who generously accepted at the very beginning to do a donation for any project in favor of Dr. Mba. And when the Diocese of Buea was proposed and he went to our website and he saw the work that we're doing there, he decided to support the diocese. And looking at the needs of the diocese, we have many things to do. I felt sympathetic with the nursery and primary school here because the pupils were there but with no classrooms.
At the time, the school was operating under extremely difficult conditions with no adequate classroom infrastructure. Children were learning in a dilapidated church building, partitioned with plywood to create makeshift classrooms. The environment was neither conducive nor adequate for the educational needs of the children. With the support received, construction began. Brick by brick, a new school rose, replacing makeshift learning spaces with a modern, safe, and dignified environment for teaching and learning. In 2023, the new St. Augustine Nursery and Primary School was completed and inaugurated.
Very happy because most of our children will not be going far away from here. They'll be attending schools, their school here is St. Augustine School. When they were here in church, it was not easy. Some parents even removed their children from this school because they were inside one school partition, inside the church. The church was partitioned in classrooms, so some parents did not like it. So, but I'm sure now that they have built this school, the children will be in their classes comfortable and the parents will be happy.
But the transformation did not stop with the school. Once the children moved into their new classrooms, attention turned to the church building they had previously occupied. The church was renovated and given a new face, creating a more dignified place of worship for the Christian community. A parish house was also constructed, providing a residence for a priest to accompany the pastoral needs of the school community and the Christians in that area. One intervention had begun to transform an entire community. As the Diocese of Buea documented the work and reported on the resources entrusted to it, confidence in the partnership grew.
And when he gave me the first amount of money, $10,000, the husband of Sandy actually gave us at different intervals the total sum of $125,000, which is almost getting to 80-something million. And this building was estimated almost to the tune of 93 million, and all the money that we received was able to do and to complete this building.
What began with one act of generosity was becoming something larger. Through Impact Changing Outcomes, Dr. Mba and a growing network of partners are helping to connect people of goodwill with initiatives that create lasting opportunities in education, healthcare, and other social amenities. That partnership has also supported the development of St. Pius X Comprehensive and Technical College, Middle Farms, Limbe. Here, young people are acquiring practical and technical skills that prepare them for employment, entrepreneurship, and greater self-reliance. They are not simply learning theories, they are designing, creating, building and developing skills that can open pathways to opportunity and a more secure future.
And the hall, which is a single system. And also the fan, which is part of the cooling system in the back.
I'm a female student of Form 1 English class Picotech. Today they taught us how to connect the bed. This is a circuit board. This is the circuit breaker. This is the connector, the push button, and the bell itself. This is a single phase, which means you have just one phase and one neutral. This is the canalization. The pins here are used to make the work presentable. The circuit breaker is here for protection, so if any fault happens in any of the devices, it will trip up by itself.
The partnership has gone beyond education. In January 2024, visiting orthopedic surgeons brought specialist consultations and surgical care to Mount Mary Hospital in Buea. 2 years later, in January 2026, another medical mission brought together expertise in general medicine, orthopedics, and plastic surgery, extending specialist care to patients while working alongside the local healthcare team.
So this is my second visit here to Mount Mary. Came 2 years, and we came at this time. More of us with Dr. Bertrand and the other colleague, Dr. David, who is a plastic surgeon, Dr. Bertrand, the general surgeon. So the good thing about this time is that we do cases. The case that we have going on now is a lady that has thyroid growth. So we are doing what we call thyroidectomy, we're taking out the thyroid. It's a very complicated disease or case.
Today, Mount Mary Hospital continues to provide general consultations, outpatient and inpatient care, maternity services, surgery, and specialist care. As a Catholic healthcare institution at the service of all people, its mission combines professional medical service with compassion, respect for human dignity, and pastoral care. But the hospital is operating within significant infrastructural limitations. Its existing facilities are no longer sufficiently accommodative for the growing demand for healthcare and specialist services. This became particularly evident during the visiting medical missions. Mount Mary currently has only one operating theater. With several specialists attending to patients during the mission, the available surgical space was insufficient, requiring the medical team to adapt other available clinical spaces for some minor procedures. It was a practical response to an immediate need, but it also revealed a larger reality. Mount Mary Hospital needs more space, more appropriate facilities, and greater capacity to respond to the patients who depend on it. Existing wards can reach capacity. The demand for specialist care continues to grow, and the limitations of the present infrastructure constrain the hospital's ability to expand its services. The next chapter is therefore the proposed construction of a modern outpatient department complex at Mount Mary Hospital. Designed to significantly expand the hospital's capacity, the new complex will provide improved consultation and patient care spaces, maternity and delivery facilities, wards and specialist services, including dentistry, ophthalmology, and hemodialysis. The estimated cost of this transformative project is at $750,000. This investment will provide more than new infrastructure. It will create the space and facilities needed to expand access to quality healthcare and strengthen Mount Mary's capacity to respond to the growing needs of the communities it serves. It is an investment in medical professionals who need appropriate clinical space to deliver quality care. It is an investment in mothers seeking after maternity services, in patients requiring specialist treatment, and in families searching for accessible, quality, and compassionate healthcare. The journey has already shown what partnership can accomplish. A gift became a school helped transform a parish community. Trust opened the way to greater investment in education. Professional expertise brought healing closer to patients. And today, through impact-changing outcomes and the Diocese of Buea, another opportunity stands before us. An opportunity to turn a $750,000 vision into a healthcare facility that will serve individuals and families for generations to come. An opportunity to strengthen Mount Mary Hospital and bring quality, compassionate healthcare closer to those in need. What began with an act of generosity has become a growing story of partnership, transformation, and hope. And that story is not finished. Together, we can rewrite the next chapter. Together, we can transform lives and build hope.